Since 1973, the ALLG has conducted groundbreaking research to influence how doctors treat blood cancer patients globally. This is our story.
The ALLG represents more than 400 clinical researchers and research scientists across Australia and New Zealand.
As a group of blood cancer specialists, our main objective is to develop clinical trials that will benefit patients with blood cancers.
Those trials are really important for us. Not only do they provide access to new treatments of relevance to our patients, but they also improve our treatments available in the long term. And what's more, they improve a culture of excellence that's critical for all that we do. And the Australasian Leukaemia Lymphoma Group plays a key role in that.
The ALLG offers us a voice to try and promote some of our novel ideas for clinical trial development, and a voice to government to advocate for better care of blood cancer patients.
ALLG members conduct clinical trials across the broad spectrum of the uncommon blood cancers: non-Hodgkin's lymphoma, Hodgkin lymphoma, chronic lymphocytic leukemia, the acute leukemias, chronic myeloid leukemia and the other myeloproliferative disorders, myelodysplasia and myeloma. So you can appreciate that with this broad spectrum of uncommon cancers, we need to collaborate to get the quantity of quality data to inform practice.
In 44 years, we have conducted more than 80 practice-changing clinical trials. Unfortunately, though, more than 13,000 people are diagnosed each year with a new blood cancer in Australia and New Zealand. So it is essential that our ALLG clinical trials continue to provide access to much-needed new therapies.
The ALLG is committed to providing support for researchers like me through clinical trial development, statistical analysis, and electronic data capture.
Our trials are very carefully designed and have meticulous safety monitoring, ensuring better treatments and better lives for our patients.
I invite you to support the ALLG in its work. It's critical for patients with blood cancers that we get the opportunity to undertake this research. It's difficult sometimes to identify and find the funding for the trials that we conduct, and we really benefit from your support.
And that's why I'll always be with the ALLG.
And that's why I'll always be with the ALLG.
That's why I'll always be with the ALLG.
That's why I'll always be with the ALLG.
And that's why I'll always be with the ALLG.